MMC know the target audience's profile, their emotional and psychological core needs, the various forms of media and platforms necessary to grab their attention, and how to structure the membership program/offer to where they know they must act now. Just because millennials are digitally connected does not mean e-marketing is the best platform to engage them about something as unimportant, at least in their lives at this moment, as healthcare. You will never capture the millennial market by telling them the only reason they need healthcare is to help offset the cost of caring for the elderly, even though this is true. A simple search about millennials on Wikipedia will provide you with the elementary data showing you millennials are distrustful of people, organizations, institutions, political parties, etc. They marry later in life and they are drowning in debt. This generation has been shell-shocked by the economic climate they grew up in. Process. Just like in the golf and health club industry, the desired outcome in this new healthcare business model is achieved by offsetting the cost of frequent users by bringing in non-frequent users. MMC achieves their desired outcome by offsetting the frequent play of core and avid golfers with memberships targeting the casual and non-golfer. That is, the millennials, bringing affordable golf to all while at the same time improving the financial health of the course. The millennials will offset the cost of caring for the baby boomers. The premise is basically the same. For example, in the health club business, we profiled and targeted the deconditioned and couch potato markets, who never worked out and rarely thought of it, to offset the cost of membership for the health and fitness conscientious who worked out 4 to 6 times per week. A health club as small as 5,000 square foot could literally sell 5,000 memberships and never be overcrowded due to the ratio of 9 to 1. That is, 9 deconditioned members who came maybe 10 times per year, and 1 being the health and fitness conscientious member who was in the health club 4 to 6 times per week. Warning, this healthcare business model too will only work if it is presented to the consumer, patient, member correctly. A lot of physicians love this healthcare business model but are struggling financially because they lack the tools necessary to acquire enough members, patients, and members, patients in the appropriate ratios to make this model work for both parties. You can have the greatest product in the world, but if you lack the skills or skill set to bring it to the market, it will fail and fall by the wayside. Our research shows the new primary care model will look something like this. The real profit margin of this new healthcare business model is in the children up to the ages of 33 patient member category. In short, the millennials. This group is the non-users but will absolutely pay an entry-level membership fee to know they are covered. This is exactly what MMC has been doing since 1991 in the health club industry and in golf since 2006 by profiling and acquiring the difficult-to-reach demographic to offset the heavy users. The previous membership fees are mirror images of rack rate membership fees being charged by MMC's golf course and upscale athletic club clients. Since 1991, MMC has raised over $60 million in immediate cash, millions more in annual residual income from profit centers, and unparalleled member retention for our partnering clients, all with absolutely no risk to our clients through self-funding member acquisition programs. Our programs, on average, acquire 1,000 to 2,000 new members for our clients, depending completely on their needs. So what does this tell us? 1, we must make healthcare truly affordable. 2, we must build a relationship with the millennials to earn their trust. 3, millennials are normally unattached, so we must appeal to their core emotional needs to get them to commit. But beware, all of this information does not even skim the surface of what you must know to profile, target, and lock up relationships with millennials. You must know your target's psychological and emotional needs and be able to show the prospect your product will satisfy those needs. If you are entertaining the idea of a new healthcare business model or just want to capture the elusive market for your practice, contact MMC today for a free consultation.